1. A young woman has weight loss, heat intolerance, tremor, palpitations, diffuse goiter, and exophthalmos. Which antibody is responsible? The correct answer is C, thyroid-stimulating immunoglobulin. These antibodies stimulate the TSH receptor, causing increased thyroid hormone production and the features of Graves' disease. Question 2. A woman has fatigue, weight gain, constipation, and cold intolerance. Her TSH is high and free T4 is low. What is the diagnosis? The correct answer is C, primary hypothyroidism. The thyroid gland itself is failing, so low thyroid hormone causes the pituitary to increase TSH secretion.
Question 3. A woman develops severe postpartum hemorrhage followed by failure to lactate, amenorrhea, fatigue, and hypotension. What is the diagnosis? The correct answer is A, Sheehan syndrome. Severe postpartum hemorrhage can cause ischemic necrosis of the pituitary, leading to anterior pituitary hormone deficiencies. Question 4. A pituitary macroadenoma compresses the optic chiasm. Which visual field defect occurs? The correct answer is A, bitemporal heminopia. The optic chiasm contains crossing nasal retinal fibers. Compression causes loss of the temporal visual fields in both eyes.
Question 5. A patient has episodic headache, sweating, palpitations, and severe hypertension. Which test is best for suspected pheochromocytoma? The correct answer is B, plasma-free metanephrines. Pheochromocytomas release catecholamines, and metanephrines are highly sensitive markers for detecting catecholamine excess. Question 6. A patient with pheochromocytoma is being prepared for surgery. Which medication should be started first? The correct answer is B, phenoxybenzamine. Alpha blockade must be established first to control blood pressure. Giving a beta blocker first can cause dangerous unopposed alpha stimulation. Question 7. A man has weight loss, hyperpigmentation, hypotension, hyponatremia, hyperkalemia, low cortisol, and high ACTH. What is the diagnosis? The correct answer is B, primary adrenal insufficiency. In primary adrenal failure, the adrenal cortex cannot produce enough cortisol and aldosterone, so ACTH rises and hyperkalemia develops from aldosterone deficiency. Question 8. In suspected primary adrenal insufficiency, what happens during an ACTH stimulation test? The correct answer is B, there is no significant increase in serum cortisol. A damaged adrenal cortex cannot respond appropriately to ACTH, so cortisol remains low after stimulation.
Question 9. A patient has hypertension, hyperkalemia, metabolic alkalosis, high aldosterone, and suppressed renin. What is the diagnosis? The correct answer is B, primary hyperaldosteronism. Autonomous aldosterone secretion causes sodium retention, hypertension, potassium loss, and suppression of renin. Question 10. Why does primary hyperaldosteronism cause hyperkalemia? The correct answer is B, increased potassium secretion. Aldosterone increases sodium reabsorption in the distal nephron while promoting potassium secretion, leading to potassium loss. Question 11. A patient has recurrent kidney stones, bone pain, constipation, high calcium, and low phosphate. Which hormone is elevated? The correct answer is B, parathyroid hormone. PTH increases serum calcium and decreases serum phosphate by increasing renal phosphate excretion. Question 12. A patient develops perioral numbness, muscle cramps, and carpopedal spasm after thyroid surgery. What is the cause? The correct answer is B, hypercalcemia. Damage to the parathyroid glands can cause low PTH and hypercalcemia, producing neuromuscular irritability and tetany.
Question 13. A young patient has severe hyperglycemia, metabolic acidosis, and elevated ketones. What causes the acidosis? The correct answer is B, accumulation of keto acids. Insulin deficiency causes increased lipolysis and ketone production, leading to metabolic acidosis in diabetic ketoacidosis. Question 14. A patient with diabetic ketoacidosis has a potassium level of 5.8. Why can potassium fall rapidly after treatment begins? The correct answer is A, insulin shifts potassium into cells. Although total body potassium is depleted in DKA, serum potassium may initially be high. Insulin drives potassium back into cells, lowering the serum level.
Question 15. A diabetic patient has profound dehydration, altered mental status, glucose of 900, very high serum osmolality, and minimal ketones. What is the diagnosis? The correct answer is B, hyperosmolar hyperglycemic state. HHS causes extreme hyperglycemia and hyperosmolality with little or no significant ketoacidosis, commonly producing severe dehydration and altered consciousness. Question 16. A patient has polyuria, polydipsia, high serum sodium, and dilute urine. After desmopressin, urine osmolality increases markedly. What is the diagnosis? The correct answer is B, central diabetes insipidus. Central di results from deficient ADH production. Desmopressin replaces ADH, so the kidneys concentrate the urine.
Question 17. A patient has central obesity, proximal muscle weakness, easy bruising, purple striae, and hypertension. Which hormone is elevated? The correct answer is B, cortisol. Excess cortisol causes the characteristic features of Cushing syndrome, including muscle wasting, skin changes, central obesity, and hypertension. Question 18. A patient has confirmed Cushing syndrome. Which test helps determine whether it is ACTH dependent? The correct answer is B, plasma ACTH. A high or inappropriately normal ACTH suggests ACTH-dependent Cushing syndrome, while a low ACTH suggests an adrenal source.
Question 19. A woman has amenorrhea, galactorrhea, and decreased libido. Her prolactin is markedly elevated. Which hormone normally inhibits prolactin secretion? The correct answer is B, dopamine. Dopamine from the hypothalamus continuously inhibits prolactin release. Loss of this inhibition causes prolactin levels to rise. Question 20. A young man has delayed puberty, anosmia, low testosterone, and low LH and FSH. What is the diagnosis? The correct answer is B, Kallmann syndrome. Kallmann syndrome results from impaired GnRH migration and secretion, causing hypergonadotropic hypergonadism associated with anosmia.